Good afternoon to everyone here. Thanks for taking the time to come. And as I say, it's always heartwarming to see that amongst the audience, there's always quite a lot of women, probably here to support their husbands or here to listen for their fathers. So it's true that when it comes to having cancer, family support is very important. So today my topic, is basically to talk about the impact of prostate cancer treatment on patients. So when it comes to cancer survivorship, it is always a long journey, from my point of view. So we have talked about diagnosis. Dr. Yuan talked about how diagnosis. Dr. Lincoln Tan talked about the various treatment that's available. And all of us is quite familiar with these. Then, of course, some make it, but some have to deal with the problem of relapse. A lot of times, what we may neglect is how to deal with the side effects of treatment for patients who actually do well, try to carry on their life and lead a happy life. What are the problems do they face and how do we deal with it? So I'm just going to talk about I'll talk about the points that are pertinent by just using two cases, to discuss. So let's talk about Mr. Tan, Of course, this is not his real name. 60 years old, restaurant owner, married. His wife is a bit younger, it's 48 years old. He has two adult children. Diagnosed with prostate cancer 2 years ago. At that time, there was a lot of fear, a lot of anxiety, a lot of discussions with his doctor. Eventually, he underwent a robotic surgery to remove the prostate. Before the surgery, of course, the surgeon discussed with him the various issues to pay attention to, including the possibility of having erectile dysfunction or urinary incontinence after his treatment. So before surgery, he did this test called the IIEF. Basically, it's an international questionnaire to assess the person's erectile function. And he did very well. He's got 22 out of 25, so he has no erectile dysfunction. He underwent treatment. The treatment was uncomplicated. After the urine tube was removed, a few weeks after that, his urine control was very good. There was no leak. He did notice that there was some absent morning erections. So when they see his doctor during follow-up, they talked about it. They discussed about the option of penile rehabilitation, basically using either medication to slowly improve the penile function. But he decided that it was not the right time to talk about this and wanted to see how things pan out. After 3 months, he recovered very well. He was back to normal. He's running his restaurant. He would check his PSA, undetectable, fantastic. So the prostate cancer has been cleared. So we expect a good outcome for him, and his libido did come back, but his erections remained too weak for intercourse. So at that time, he saw his doctor again and asked, why do you think this is the case? So showing a diagram, this is the anatomy of the penis, The penis essentially, is we call it the phallus, a longitudinal organ. Inside it is actually this, what we call corporal bodies. These are actually spongy tissue, which gets filled up with blood during erection, and that's what makes it get hard, and stay erected. So during the treatment, during the surgery itself, I think just now Dr. Lincoln Tan showed you how robotic is done, and he did mention that nerves are usually not that easily identified. So over here, you can see there's a treatment dilemma. Right here on the left side is a prostate, just next to it are these nerve bundles that basically goes to control erections and subsequent urine control. The nerves are running over here. So to remove this prostate cancer completely, and trying to preserve the nerves, everything intact, is a challenge, which is why we have these problems of patients who do well in terms of cancer, but go on to may have problems of erectile dysfunction and incontinence. So he asked the doctor, what can I do now? So the doctor says, well, erectile dysfunction, the most common treatment, we call the first-line treatment, is to use drugs. Something someone very familiar with will be Viagra. It's one of the drugs that really revolutionized the way we treat erectile dysfunction. So there's also other medication, Levitra, Cialis. Well, what do these medications do? Basically, when the person takes this medicine just maybe half an hour to 1 hour before sex, It can improve the blood flow by relaxing the smooth muscles, what we call the smooth muscles of the penis, allowing blood to go in. All right, but this is only for situations whereby the erectile dysfunction is not too severe. Because a lot of times, if the erectile dysfunction is too severe, this is not going to work. But nonetheless, it is easy to use, all right, effective in a lot of situations, and relatively safe once you are aware of the indications and what are the side effects to watch out for. He tried it out. Mr. Tan tried it out, but he waited 6 months. Nothing. He didn't even get a little bit bigger. He waited 1 year, 18 months, nothing. So he asked his doctor, why is this so? What can I do now? So why is this so? Well, if the nerves are able to heal, they usually heal within 18 months. Beyond that, we are unlikely to see any remarkable recovery in terms of the function that's controlled by the nerves. So what are his options? So the doctor says, when the pills don't work, there's a second-line treatment and third-line treatment. And what are they? Number one is we can give you injections of stronger medications into the penis, right? Half an hour before sex, help to get the erection to facilitate intercourse. Or you can try using vacuum devices. And of course, there's option of doing surgery to put in a penile prosthesis. So what injections are we talking about? Well, basically, as I showed, the penis is basically made up of two bodies of spongy tissue. This is the urethra, where the urine comes out, the urinary tract. So we inject medication that can drive blood to the penis, directly into the body of the penis. And usually between 15 minutes, half an hour, you should see a fairly good erection if the person is still able to do so. All right? Success rate can be between 60 to 80% in general. Of course, there's a problem of prolonged erection, which can happen, or pain. So there are advantages. The downside is, of course, most patients that we see, they may not like the idea of having to inject themselves each time they are going to have be intimate. Then what else can they do? Vacuum device. What's a vacuum device? Well, this is a vacuum tube placed over a flaccid penis. Then once you create a vacuum within this tube using a pump which can be battery operated or hand operated, the negative pressures draws the blood by force into the penis to give an erection. And while the blood is still trapped within the penis, quickly put a constriction band, a very tight constriction band over the base of the penis, release the vacuum, and have an erection. All right? Have intercourse. After that, remove the rubber band, and this will come down. All right? Now, is this what's the advantage of this vacuum device? Well, it does work. It does work. It may even give a success rate as high as 90%. But the dropout rate is also quite high. Reason why is because to do this, you need to have a fairly supportive partner. Your fingers must be dexterous. Otherwise, what's going to happen is you take out the vacuum pump, the partner's going to laugh at you. Oh, why is this? You know, and then it just spoils everything else. And well, what I'm saying is actually what the patient feedback, right? And at the same time, this type of erection is not like the real erection because you are actually trapping blood within the penis, not in the normal erection whereby blood is going in and running out all the time. So the penis becomes discolored, the erection is cold and uncomfortable. So what happens for Mr. Tan when he say that both the vacuum device and injections are just not for me? What else can I do? Then we'll be talking about the third line of treatment, which is the use of penile prosthesis. Prosthesis, well, two big groups. The malleable is basically like a metal rod you put into the penis, and it can be, later I'll show you how it works. And then there's the inflatable three-piece, which is actually the much preferred way of putting a penile prosthesis now. All right? So how do we do the operation? We make a little cut in the space between the penis and the testes, all right? And then through this hole, we'll put in the prosthesis. So you can see the prosthesis lying within the penis itself. And then we close it up. Operation takes about probably 1.5 to 2 hours. Patients may need to stay overnight for 1 to 2 nights. After that, they go home. They'll be resting at home. And we don't allow them to use this device until at least 6 weeks after recovery, when all the healing has occurred. The biggest risk for this procedure, of course, is infection. So if there's any form of infection, it's bad news. Because if the prosthesis becomes infected, it has to be taken out. and reinserted another time. So this is what it looks like after insertion of prosthesis. I say it's concealed, it's inside the patient. So when it's deflated, it's fairly flaccid. When it's inflated, it becomes hard. So the malleable basically is like a metal rod within the penis. When they want to have intercourse, they lift it up. Once they have once they have completed that, they can push it down. All right. For the inflatable one, basically, when they want to have an intercourse, they press on this pump, which will bring in fluid into the penis to create a hard erection. Once they are done pressing on the same pump, will cause the fluid to go back into this balloon reservoir here, and the penis to come down. So these are the ways whereby erectile dysfunction can be treated. All right, so so the point is erectile dysfunction after prostate cancer treatment can be managed when it happens, and it can be managed effectively using a stepwise approach. Let's talk about the other patient, Mr. Lim. All right, Mr. Lim is 70 years old. He's a retiree. He likes traveling. He likes to play golf. He was diagnosed with prostate cancer about 3 years ago. He underwent surgery, but for him, he was not as fortunate. The tumor was at least locally advanced. It was involving the margins of the tumor that was removed. What this means is that he has some cancer cells left behind him, and he needed additional radiotherapy, to treat him. All right. A few months after the treatment, he noticed that he's leaking urine unknowingly. We call it urinary incontinence. All right. Because it is quite embarrassing for him, he had to wear urine pads within his undergarments, and he also stopped his traveling and stopped playing his favorite sport. So why is this happening? Well, the urinary system is actually a very simple system. You have urine that's stored in the bladder. When it's time to urinate, this urinary sphincter, which is a muscle that opens and closes the opening of the tract, right? You will relax, urine goes down, trickles down, and the person voids. So what happens is when it comes to treatment for prostate cancer, if the urinary sphincter, if this little muscle here that controls the urine going in and coming out gets affected, they are going to have problems with incontinence. So what did the doctor advise? Well, it's still early. Let's try some pelvic floor exercise. All right, you can see a physiotherapist. I can teach you how to identify the muscle that controls the urinary sphincter. It's basically the same one that controls the fecal, your feces. All right, so you can train it, exercise it multiple times, many sessions a day, and we hope that after a few months, your incontinence will get better. A lot of times, this actually does work. From having a very bad leak, it can become a very little leak, very occasional leak, or leaking only when you cough, when you strain. But in Mr. Lim's case, it was still leaking. All right, it was still leaking all the time, and he needs more than 5 pads change a day. Now, in the long term, what should Mr. Lim do? I'm trying to get back my life after I have survived this prostate cancer. So what should I do? Well, practically speaking, there are a few options. Besides surgery, there's actually a lot of whole host of other products that can actually help a person cope with incontinence. Because incontinence is not really just a result of prostate cancer treatment. It exists, even in various forms and due to many reasons. So absorbent products like diapers and pads. Diapers, adult diapers, they wear all the time. It's uncomfortable, especially in Singapore where the weather is hot. And sometimes, when they delay the change, the smell can affect them. And of course, the pads they can lay within their underwear. All right. So these are options that can be used. All right, and quite easily used. May cause skin irritation, may have leak, may have smell, may be obvious. But these are actually options that a lot of patients are using when they deal with incontinence. You see this large clamp here, all right? See, it's called a penile clamp, all right? Probably nobody will show you because people wearing it won't want to show to others. You put a big clamp across the penis and you have to generate quite a lot of force in order to prevent the leak, all right? So it's inexpensive, can be discreet, but uncomfortable. After prolonged use, may cause pain in the penis or skin erosion. Then what else? If it's a really bad leak, the person is not moving much, you can consider using a catheter. A condom catheter is basically something that you put on the outside of the penis that links to a tube that drains into a bag. So whenever they leak, the urine comes out through the tube into a bag. Indwelling catheter is something that you put inside, through the penis, through the urinary tract, into the bladder, and it stays there, held in place by the balloon. And again, connected to the bag. Every time there's a urine, it comes out, all right, through here, connects to a tube into a bag. Now, this one requires patient to really take care of the catheter in the bag. Of course, this form of managing incontinence has its issues. Number one, the person has to be carrying a urine bag all the time, which is not desirable to a person who's fairly active. And after a long time use, it's prone to getting urine infection, abrasion, or the tubes can get blocked. So what other options can they have in terms of surgical treatment? Well, there's this option of inserting a male sling. A male sling is basically this type of a mesh that we put just below the urinary tract, all right, to provide some support and increase the angle of control for the urinary tract to improve continence. It's like a hammock. It's good for mild and moderate stress urinary incontinence. So, you see, this is a video. Okay, so basically, you put it this is where the urethra is. From outside, this is what you see. On the inside, this is what happens, all right? When you put the sling and you tighten it, it helps to decrease this opening and increase the pressure, and that's how it provides greater control for urine incontinence. So this itself, the way we insert it is fairly similar to how the penile prosthesis is inserted. All right, so in terms of success rate, we can see reports have shown between 50 to even 90% success rate. And it's something that can help patients cope with the problem of incontinence in a more permanent fashion, all right? Of course, with any kind of surgery, right, the risk of wound bleeding, wound infection, and erosion means the material cutting through the urinary tract tissue. Or these are some of the issues that needs to be taken note of, all right, for this type of treatment. Who is it not suitable for? Patients who are getting recurrent urine infection, they have problems with blood clotting, very poor immunity and wound healing, or obstructed urinary tract. These patients are not suitable candidates, all right? But of course, the best thing is always to discuss with the doctor what's the best option. The next treatment, all right, if the sling, even the sling doesn't work, what happens when the person has a severe incontinence? Well, there's this device called the artificial urinary sphincter, all right, which is basically a kind of a prosthesis as well. It's concealed within the patient. There are three parts to this device, all right? There's the cuff here, all right? There's this, what we call the pressure regulating balloon, and then there's a control pump. How it works is you put a cuff around this urinary tract, which leads to the bladder, all right? In the resting state, it will be filled up with fluid, and you close up the urinary tract, all right? So it surrounds the fluid. And when the person has the urge to urinate when the bladder is full, he will have to press this control pump, all right, to deflate the balloon and so that urine can be emptied. Then after he has emptied his bladder, the cuff will fill up again to restore his continence. So what I want to do is to show the video of how this artificial sphincter works. So you can see, in the resting state, the cuff is inflated, all right, the cuff is inflated, so it closes the urinary tract. All right, this is where the pump is, and this is where the balloon is. So when there's urine, the urine is not able to escape because of this pressure cuff over here. All right, when the person wants to void, he presses the valve, the fluid from here enters the balloon, empties out, urine comes out. Once he's done with that, slowly, the pressure over the cuff will build up again to restore his continence. All right, so similar to the penile prosthesis, is a concealed item that's underneath the skin. Takes about 1.5 to 2 hours to put in. Duration of stay is about the same because the wound size, all that is about the same. And the person can start using it about 6 weeks after insertion. And the biggest risk for this is, again, infection. All right, who is this not suitable for? Those who have problems of finger dexterity. Means they need to control the pump, otherwise it won't be useful to them. Those who have very severe urine tract obstruction, there's blockage on top of the urine leak. Those whereby the bladder has lost its function. So the bladder can be filled with urine, but they have no sensation, they're not able to contract, not able to void. Then these patients are not suitable. And of course, those who are allergic to certain antibiotics, because these devices, they are impregnated with antibiotics. So just to have a short summary of what I've discussed. Number one is after successful prostate cancer treatment, some patients may develop erectile dysfunction and urinary incontinence. Erectile dysfunction-wise, it can be managed effectively using a stepwise approach from medication, injections, all the way to surgery. In terms of the stress urinary incontinence, similarly, there's a range of both conservative, usually use of pads, catheters, and surgical options for them. Okay, so with that, I'll end my talk.